Hi everybody, have you been diagnosed with a hypothyroid or Hashimoto's disease or both? And the question is your thyroid medication actually helping your thyroid? Now let's talk about it. Now before we do, please, if you're taking thyroid medication, put in the comments what you're taking and if you're still having symptoms, because we're going to talk about it. The answer is no. The thyroid medication is not doing anything for your thyroid or your Hashimoto's disease, the immune system problem that's actually causing hypothyroid. It is only replacing the hormone that your body can't produce. And it doesn't matter which type of medication you're taking, whether it's a levothyroxine synthroid or a combo, which is like Armour or MP thyroid, or a strict T3 medication like cytomel or liothyronine. Keep in mind, 90% of all hypothyroid cases are caused from Hashimoto's disease. So if you've been diagnosed with a hypothyroid, you probably have Hashimoto's disease. The sooner you realize that Hashimoto's disease is not treated by Western medicine, by your primary care physician or your endocrinologist, they don't treat Hashimoto's. They treat hypothyroid that's caused from Hashimoto's disease. So they're not treating the root cause of the problem. So the sooner you realize that, the sooner you realize that you're gonna have to look outside of the medical box and you're gonna have to look on your own, you're kind of on your own, to start addressing Hashimoto's disease. And here's the truth about Hashimoto's disease. Now, I know your doctor probably told you there's nothing you can do about it. Well, there is something you can do about it. You definitely can put Hashimoto's into remission. Listen, I'll say it again. You can put Hashimoto's into remission, but taking thyroid medication by itself won't do it. Now, it doesn't mean you need to stop taking your thyroid medication. It is part of the solution, at least for now, because you need it until we can fix it, and there may be a chance you may be able to come off of it. Now, your doctor takes you off. We don't do that. But about a third of our patients can come off their thyroid medication. So what do you do now? Well, what I suggest you do is reach out to us. This is what we've been doing for 20 years, 7,000 patients, helping them through and guiding them through this process of putting their Hashimoto's into remission. Because this is partially why you have still having symptoms even though you're on thyroid medication, because they're not addressing the problem. Reach out to us. You can hit the sign up button. Call us, email us, DM us, or do a free discovery call. Do something to reach out so we can help you through this process. Don't give up.